For over 60 years, the ARC Alliance has been in your community, providing support and services for families and individuals with special needs. From birth through life, the ARC Alliance team of experts and specialists are here to find solutions to your needs.
For years, we felt alone as we take care of our son. The ARC Alliance support team brings compassion and understanding to our family and provides hands-on solutions.
The ARC Alliance, we're here to help you today. For more information, call 610-265-4700 or visit thearcalliance.org.
Welcome to the ARC Alliance's Bridges in the Community. My name is Nikki Krelovich, and I'm the Executive Director for the ARC Alliance Foundation. Today, I'll be your host for a discussion with Joe McDonald of the ARC Alliance. Before we begin, let me tell you a little bit about the ARC Alliance history. The ARC Alliance was established in 1951 by a group of concerned parents, and today we remain a family-focused charitable organization that provides a variety of support and services to individuals and their families, ranging from early intervention supporting children from birth to 3 years old, advocacy, supports coordination, guardianship and representative payee services, which support individuals throughout their life, a variety of individual and family-focused support groups, and programs. And in addition, the ARC Alliance is a great resource for support on a wide range of issues and concerns. For more information, you can check out the ARC Alliance at our website, www.thearcalliance.org. I'm frequently asked how a person or a family member can get more involved, and the simple answer is to become a member. Simply go to our website and use the contact form for additional information on how to become involved. Today, we're going to speak with Joe McDonald. Thanks for joining us today, Joe.
It's a pleasure to be here.
Why don't you tell us a little bit about yourself and your involvement with the ARC Alliance?
Sure. Well, as she said, I'm Joe McDonald, and I'm the current president of the board of directors for the ARC Alliance. I've been involved with the ARC for approximately 35 years, serving on the board or committees through that time. And in the past, I was also on the board of the ARC of PA. That's what I do for my volunteer life. When I was working, which I just retired recently. Anyway, I spent 40 years working in the human service field, working with individuals with intellectual and developmental disabilities, running group homes and a workshop in Montgomery and Bucks County. So I have a little experience in this field.
You absolutely do. So what are you here to talk to us about today, Joe?
Well, today I'm here to talk to you about a project that the ARC Alliance is coordinating as part of the state, the ARC of PA's project to look at healthcare disparities related to COVID for individuals with intellectual disabilities, especially those from minority groups or rural populations.
Oh, wow. Well, tell us a little bit about the purpose of this initiative.
Well, the purpose of the initiative is to bring together stakeholders in different aspects of the community, the healthcare field, the health providers, the disability field, to come up with what actually worked during the recent pandemic, what didn't work, and most importantly, what can we do in the future to ensure that the people with disabilities have better representation and better access to all the aspects of the services that they need during these times.
Oh, wow. So tell us more about the key groups that are involved with this initiative.
Well, as I said, I'm coordinating the local effort, which will be for the counties that the ARC Alliance serves, which are Berks, Bucks, and Montgomery, but we're also doing it for Chester County, so they're part of our group. So we're doing the 4 counties, suburban counties around Philadelphia, and the work groups are also meeting throughout the state. Each of the ARCs were offered the option of participating in this, and many others chose to participate. So they also are running these same work groups throughout the state. And then the other people that are in it are obviously the state ARC. They have a task force of stakeholders in Harrisburg and throughout the state, higher level, that are meeting to come up with the same ideas what to do regarding the disparities. And then the ARC also is providing an administrative team to actually make the whole project work.
What are you hoping for as far as the outcomes go?
Well, the basic outcome is to make it better for the individuals with developmental and intellectual disabilities, so they have access to the services and to the information that they need. Historically, well, just in general, people with disabilities have had a higher incidence of COVID during the pandemic. They've been diagnosed with it at greater rates than the general public. They've been admitted to hospitals at a general rate, admitted to ICUs at a higher rate, and their mortality is second only to the aging population as far as the effects it's had on the disability population. Wow. So we need to work on systems and processes to ensure that if something like this happens again, that they'll be better represented in the plans that are developed. So we're looking at technology issues, communication issues, transportation issues, access issues, to address those issues that impact the person's ability to get the services.
So can you tell us a little bit about the timeline of this project?
Well, this project actually started, we had our first work group in November, and the work groups are meeting every 3 months through July of 23. And then in addition to the work groups, which basically are brainstorming the strengths, what were the barriers, what didn't work, and coming up with some solutions, we're holding what they call listening tours. Okay. So we had the first listening tour, the state operated that in January, and there'll be 3 more through the end of the project. Excellent. But locally, we're also holding listening tours with any group that would be interested in participating or even just talking to individuals to get their stories. You know, how did they access services? What were the hang-ups? And they're getting some pretty dramatic information.
That's great.
Yeah.
So if there's a group watching us today that's interested in having a listening tour, come and visit and speak to them, or do it virtually, can they just reach out to the ARC Alliance to set that up?
Absolutely. I believe I have a phone number at the ARC Alliance, but I don't know it off the top of my head.
They can call us.
I think we could probably post information, and we will be posting more information on our website to talk about the project. And that will have the contact information.
Excellent.
Yeah.
Excellent. And we could even include maybe some of those dates for the upcoming listening tours, yes. If they want one to come to them, or if they would like to attend one of the tours that you already have scheduled.
Absolutely. The next state one hasn't been scheduled, but it'll be in the spring sometime. And I'm fairly flexible and can do it at their convenience, basically.
All right.
Whenever they get a group together, I'll be happy to talk to them. And we can do it by Zoom because I know people still are uncomfortable with having group meetings.
Absolutely. So tell us more about some of the goals of this program.
Well, in addition to the one I talked about as far as forming relationships with the different groups that are participating in the community, the ARC is also developing educational materials that will be posted on their website and our website, and that will be distributed out into the community that will be more accessible for people, especially with intellectual disabilities, and that it'll be in one place. Because one of the problems during the pandemic is people with intellectual disabilities are not always familiar with the technology that came out. And I'm certainly not familiar with technology, so I understand the struggle. But some of these folks live home alone and don't have the supports because, again, during COVID, some of the supports were not there for them. So they were pretty much left on their own. So trying to get it in one place that's easily accessible is really one of the goals, and out into the community. And the final goal will be that we will be writing a report, or the state ARC will be writing the report that will be submitted to the ARC of PA.
Okay.
Right. And I don't know if I mentioned this, but the initial funding came from the U.S. Department of Health, the Center for Disease Control, and that went to the State Department of Health.
Okay.
So there's government oversight and expectations involved in this project.
Absolutely. Do you have some stories you can tell about some individuals who...
Well, in some of the listening tours, we had people speaking, and I'm not on top of all the details, but the one woman lived in an apartment who had a son with autism, and she suffered from anxiety and was not able to get a hold of the apartment complex after a complaint was filed about them because her son would play the radio or the record player too loud, and a new neighbor filed a complaint. But due to COVID, the apartment complex was not staffed and had an answering machine, and she never got a message back. And then she was dealing with eviction notices.
Oh, wow.
And was not able to get any support.
Oh, my
So
goodness.
that's still something that's going on.
Wow.
So that's fairly dramatic. And another is for an individual that had a disability that lived on their own in the community, in a rural community with in-home supports. And one of the caretakers came into the program to provide services and then called her the next day that she had tested positive for COVID.
Oh, no.
So she was not coming back. And when this individual contacted the agency said they could not send someone in because the individual had been exposed to COVID. So she was left without services.
Wow.
It was an area that did not have public transportation, so she couldn't go out to get her medications and whatever.
Wow.
So again, it was a major problem for this individual.
Absolutely. And through no fault of her own,
Right.
she had this exposure and was no longer able to get her services as a result.
Exactly.
Wow. So the ARC Alliance and the ARC of PA and the National ARC, the focus is really on inclusion and serving folks with individuals with disabilities in their homes and in the community so that they can be part of everything. Something like this, we want them to be included, but on the other hand, we're not providing them the resources they need when we're in a pandemic so that they can still receive their services in the community.
That's correct. And I just want to clarify that was not someone that the ARC Alliance would provide services for, because I'm sure that Paul and Pat would have moved mountains to get someone in there to help them. But unfortunately, those kind of things did happen, and it's a difficult situation. I know that the providers are struggling to get staff, and they've been struggling to get staff, and the pandemic only made it that much worse.
Absolutely. There's been so many struggles, and it's great that you're part of this initiative to identify what those issues are so that we can prevent them from happening in the future.
Well, hopefully, and we do have a really great group of people working on it. The members of the group We have people in our local work group representing the county governments, the departments of development and disabilities, intellectual disabilities, mental health or behavioral health. We have people from United Way, Special Olympics. We have a couple of doctors and some nurses. And we actually have one of the nurses was one of the authors of probably some of the literature that we'll be posting on our site,
Excellent.
the research study. Let me see, we have people representing the Blind Association, from the deaf community. So we've tried to get a number of people that are, have experienced this and can come up with good solutions for it. Then there'll be the problem or the challenge will be to get them implemented.
Yes, as it always is, right?
Right.
But it starts with this research and identifying the problem, which it sounds like you
Exactly.
are doing a great job with.
Right.
You mentioned some research and educational materials. Would those be available to viewers who are looking for more information on the ARC Alliance website?
Yes, I believe they're going to be posted shortly on our website so they could see it. They probably are on the ARC of PA's website also.
Excellent.
So they'd be available for that.
That's wonderful. Why don't you tell us a little bit more? I believe that we've got some research and data on the disparities of individuals with disabilities.
Sure,
during the
and I
pandemic.
don't remember it off the top of all of it off the top of my head, but some of it's fairly dramatic. I mean, people with disabilities are more likely. Did we talk about this already? I think we did.
More likely to
get COVID, be hospitalized, go in the hospital, and die from it. There's also people from the minority groups also suffer from the same higher incidence of COVID and hospitalization and poor health as people with disabilities. So if you have a disability and you're from a minority, you've got, double jeopardy, I guess, going on there.
So Joe, tell me a bit more about the issues with disparities among
Sure. Well, individuals with disabilities have less access to appropriate health care for one reason, due to cost. People with disabilities are unemployed at a higher rate than the general public. They don't really have the funds for it, and they defer getting treatment because of the cost. They also have stereotyping by the healthcare professionals, in that there's been some research done, and only 56% of physician offices felt comfortable serving someone with a disability.
Wow.
And I believe that the rate is much higher for the number of physicians said that they did not feel that they were adequately able to provide the same level of service to a person with a disability as they were to a non-disabled person.
Okay.
So, I mean, their attitudes affected.
Yeah.
But if you get to the physician's office and you don't have support of someone, then just going through the health statements and the forms that we all get when we go to those offices that have to fill out are challenging for people with disabilities.
Indeed.
Trying to navigate the portals that, since we went to telehealth over the last 2 years, trying to navigate the portals is a challenge, and sometimes it's insurmountable for some of our folks. The technology is difficult. People in wheelchairs don't always have access in the offices to wheelchair scales so they can do a preliminary assessment.
Wow.
People that are blind don't have access, to the issues, the supports that they need in a doctor's office, or there probably is no ASL interpreter for the deaf community when they get there. And with the shortage of staff and the way things have been over the last 2 years, that made it really problematic for our folks. So there's multiple factors, and there's more than I'm even touching on it right now.
Absolutely. Oh my goodness. Well, this has been really enlightening. I know I certainly have learned a lot about the issues that a pandemic has posed, especially to the community with, individuals with disabilities and their families. And I'm sure there are others who would like to learn more or to get involved. What's the best way for our viewers to get involved?
Well, I think if you go on our website, we'll be posting a notice of how they could contact me. Plus, we will have additional information on there where they can review the slides and the resources that are available. And if anybody would like to give me feedback or tell me their story, I'd be more than happy to hear it.
That is wonderful. Joe, thank you so much for being with us today and sharing all of this information about this wonderful initiative.
Well, it was a pleasure being here, and hopefully this gets out to the people and they get it motivated to join.
Absolutely.
That's going on there.
I believe we have some slides that we can share with our viewers that go into the details of those disparities that you talked about, Joe.
Okay.
Let's roll those slides. Thank you for joining us today for what I hope was an informative and beneficial program. If anybody is interested in getting involved with the ARC Alliance and help us achieve our full mission of inclusion, you can go to our website, thearcalliance.org, or call us at 610-265-4700. Thank you very much, and we look forward to being with you again next month.